meeting will please come to order. Members would take their seats. Okay, good afternoon, everybody. Glad to see a lot of people here for our hearing and another continuation, really, of our hearing yesterday, which was an overview on autism. Quorum is present, and we have minutes. Yep. And first order of business would be to approve the minutes of January 29th. Let's see, is there a motion to approve the minutes? Representative Fritz moves to approve the minutes of January 29th. Is there any discussion? All in favor, please say aye. Aye. All opposed, no. The motion prevails. The minutes are adopted. Thank you. So we have before us House File 181, and since Representative Norton is not a member of this committee, I will move House File 181 be recommended to pass and be referred to the Commerce and Consumer Protection Finance and Policy Committee. And then Representative Norton, you have an author's amendment, I understand.
Thank you, Madam Chair. I do indeed have a very short author's amendment. And the A13-0008.
Okay, so I will also move the author's amendment, the A13-0008 amendment, to put the bill in the order in which Representative Norton would like it heard. And Representative Norton, why don't you just explain to us briefly what the amendment does? Well, actually, we don't need that. If it's okay with members, we could just vote on it to get it in the shape the author would like, and then she'll discuss it, and I'm sure she'll explain as well what she did here in the amendment. So is there any discussion on the author's amendment? Okay, all those in favor, please say aye. Aye. All opposed, no. Okay, thank you. The amendment is adopted, and the bill is in the shape the author would like. And Representative Norton, please proceed to explain your bill.
I will, Madam Chair. Thank you, and thank you to the members for hearing House File 181. For some of you that have been around a while, this issue is comfortable. For some of you that are new, it may be a little less comfortable. This was a bill that was introduced a number of years ago. This year's submission reverted back to the initial bill that we had that passed this body, and I'll give you a little bit of history of that in a few moments. I'm bringing it here today based on an experience I had in a private life at a different time and subsequent interactions and communications since then. So I just want to give you a little bit of background about why this bill is here so you understand it. You had a lot of the history yesterday, and we'll touch on that more and answer any questions you might have as we move ahead. In a previous life, I worked as it was called the Interagency Family Connection, which it was always an awkward thing to introduce myself to families, but hi, I'm the Interagency Family Connection. And what exactly that was a birth to three position funded by Part H federal funds. And you don't need to know the ins and outs of all that, but I think it's important to know that in Minnesota we have birth to 3 and 3 to 5 services before children with special needs get to school. That was touched on a little bit yesterday when the department testified, and they're hoping to enhance those services, which I think is fabulous. But I would go into households when children were diagnosed with a disability or were developmentally delayed. Sometimes those developmental delays were just suspect. The child wasn't talking, wasn't crawling, wasn't sitting when it should be, and I would come in either at the request of the parent or a provider, a physician. And during my 3 years doing that job, I had probably about 30 kids a year that we would put into the Birth to 3 program. But my last year, we had 6 children in a very short period of time, and they were all diagnosed with autism, classic autism. And these were children that were 18 months to roughly 2 years, 2.5 years old. And something was going on, something was happening. And when I was working with those families, because my job was to make sure that they got the services, that the child got the services they need and the family got the support they needed as their child was going to be rolled into some special education or special services early, hopefully to bring them up quickly to speed with their peers. And what I found with these children that were diagnosed with autism is the families would say, I have insurance. This is great. I can get some extra help for my family. But what really happened was they would go to a provider and they would be told, and the school district could offer, and the Part H funds could offer a little bit, maybe a day a week or some home visits, but not comprehensive services that these children were prescribed and needed. And their insurance companies were saying, we're not going to provide that service. We're going to turn you down for the intensive early intervention that you've been prescribed. And what I ended up doing was helping these 6 families find another way to get services for their child. And what that meant is that they would enroll in medical assistance through the TEFRA program at the state. So these were families that were in the city who had insurance, who had to go get more insurance. And over time, the co-pays for that insurance increased, and I think you heard yesterday, Brad Trahan testified and talked about it was getting up into the $800-900 a month for his co-pay for a second insurance policy in addition to all his daily living expenses and his own policy. And so that's how I became interested in it. To me, that's the heart and the crux of this matter. These are families that have insurance. They expect their insurance to cover the services that are prescribed, and they're being turned away, and they're coming to the state. Had this bill come before you and passed, and a form of this bill did come before this body and passed this committee and Commerce Committee and got to the floor of the House and ended up being amended on by this body. And unfortunately, the Senate didn't hear the bill and have it in their omnibus bill, and it got tossed out 2 years in a row in a conference committee between the House and the Senate. Had we done it then, there would have been a cost savings of several $1 million to the state. Unfortunately, we have, because we didn't pick an essential benefit set last year that had ABA services covered, and this bill, as I'll talk about in just a second, really targets, adds ABA as one of the covered services. We now are going to have to add it to our essential benefit set. And for those of you that are nervous, yes, it is an insurance mandate. But the state now will have some skin in the game and will have to fund a portion of this, the expense for the companies. So what we have today is something that is fair, overdue, and very necessary for the children of this state who have been diagnosed with autism or ASD, somewhere on the spectrum. The children that we're going to really target with this bill, all children will have the assurance that they have coverage, but those on the severe end particularly benefit from the early intensive therapies, and we want to make sure that that 1 in 88 diagnosed with ASD right now, that the small percent that need ABA have access to it, and they currently don't. I do want to also mention just a couple things. Not every family needs ABA therapy. There are many types of therapies. There are providers in this very room who provide wonderful services and varied services that are very appropriate for children on the spectrum. ABA is excluded, and some of you will ask why the specific language in the bill. ABA and IEIBT and any other number of acronyms that might be named, the early intensive is considered a gold standard and is appropriate for a small percent of the children on the spectrum. The other services that are out there, the traditional ones, speech therapy, occupational therapy, physical therapy, and other behavioral therapies are still very appropriate, are covered for the most part by most insurance companies. So we're going to make sure that all that are covered now are still covered, and we're going to ask that ABA, Applied Behavior Analysis, which you heard about yesterday, is also in that choice for families. I want to make clear to everyone that MA, and this is a technicality, but you need to understand it. CGIP and MA have been providing ABA therapy. However, CMS, the federal regulator, does not allow bundled services to be paid for, okay? So when children are getting therapy by their provider, and it is an ABA-style therapy, it is being billed as individual skills therapy, family skills therapy, or any other number of codes, probably speech therapy and occupational therapy. The therapies are broken down by code. A couple states actually have applied for and gotten a waiver to be able to do a bundled service, but it does require an application, and the state of Minnesota has not applied or received that waiver. So the MA clients the CGIP clients, the other clients that are getting ABA services are just, the providers are billing it back as skilled services or individual skills therapies. So it's complicated. Someone will say MA doesn't cover ABA. They cover the services under ABA, but no, ABA as a listed code does not appear anywhere in the books. But I have, along with a lot of research, I also have the CGIP plan and the information on MA to show you that indeed it is covered. And if you want documentation, I have it. I have about 3 times as much in my office. I'd be happy to share it. And on that note, I did share a handout, which I hope is in your packet somewhere, that kind of, someone asked, I think it was Representative Mack asked yesterday, how do we know if this works? Do we know cost benefits? And I just gave you a couple quotes from a few of these articles, and I have them all tabbed here so you can come look at which ones they are, the American Pediatrics Journal and a number of others where there is some justification for this. One of the complications that you'll probably hear about and you should know is that often the research done on, in particular ABA therapy, is done on individual children and their growth and development. It's not done in cohorts. It's very difficult to not treat a child and have that comparison from a child that's treated and one that is not. So they're often individual single child research studies, and sometimes I noticed in the federal AHQ, whatever their form is called, that was one of their concerns about the research, is that there weren't these big modeled research, that they were all the single individual research models. So what I'm asking today is for you to support the children and their families in Minnesota with autism by adding ABA services to the spectrum of services that the spectrum needs. In this bill, it's very simple. We actually pared it back from the bill that had started to get more complicated, so hopefully it's very forthright in what we're asking. And we have put language in there, comfort language for some, that says MA patients will receive the same services they are now, as well as CGIP. They're not being affected by this, that this is just on the individual market. So I could probably talk for 10 days on this subject. I've read a lot about it. I've worked in the area. One of the questions that always comes up is the cost. That was talked about yesterday, so I won't go into that. The other some issue that often comes up is, will small businesses and taxpayers be hurt by this mandate? Well, A, the state now is going to be involved in paying for some of it, but also the state is currently covering children on MA and TEFRA and MCHA, which we haven't even talked about, and I believe you have a handout about utilization, which we can talk about later if you like. The state is paying for those, and providers in some respects in MCHA are paying for it too already. We are simply saying that this needs to go back into the private market for the families that have private insurance, and that if we don't provide this service and children don't get the services they need them, when they're young, we are all going to pay the price later on with a lifetime of services and dependency on the state of Minnesota, and not to even touch on the hardship for families. So I'm just going to kind of leave it at that right now, see if we have, I know there are many people here who would like to testify. I think you're just going to take a few, and then we'll address any questions that you have along the way.
All right. Thank you, Representative Norton. And you have a testifier with you. I think, did you want to testify? If you would please introduce yourself for the record and tell us if you're representing anybody or who you're with, and then go ahead and give us your testimony.
Okay, thank you, Madam Chair, Representative Norton, for inviting me here today. My name is Jean Bender, and I'm here today representing the ARC Minnesota, supporting this bill with the amendment. I'm also representing the Autism Society of Minnesota, who supports this bill and the amendment. I am a board member of both organizations and a public policy volunteer for both organizations. So I first want to state that I represent those organizations, but I want to add I'm also a family member. And my testimony today is going to talk more specifically about my experience as a family member, because I think that's what will be most helpful for you in understanding why this bill is so important. My oldest son, David, is 26, and autism spectrum disorder is one of the diagnoses that he has, and I would say one that has impacted him most significantly of all of his diagnoses. Throughout David's life, I have done many and experienced many of the things that you'll hear other parents testify. I've quit my job and left careers 5 different times over the course of his lifetime because at different stages it was too difficult to work and provide his care. We have canceled family trips and vacations. We farmed David's siblings out to friends and other people to take them to activities because David couldn't go along. We've had my son's siblings. When I quit my job the last time, our agreement was that we would pay for their college tuition. When I had to quit my job, my other kids had to take college loans to cover the parental portion because the majority of our family income goes to support my oldest son. I also have a nephew who's 8, who's also on the spectrum. And you've probably all heard the numbers 1 in 88.
Ms. Bender?
Yes.
Yeah, I'm sorry to interrupt you. I just need to let you know that we need to kind of get through your testimony a little bit quickly because we have a lot of other testifiers. How much do you have left for us?
I can give you about 1 more minute.
Okay, that would be great.
I also have a nephew on the spectrum. He is 18 years younger than my son. And what I wanted to say are when David was young, services were available. We could get tougher with the minimal copay. We got medical insurance. Actually, our health insurance covered many of the things. But we didn't have a lot of information about autism and what was affected. 18 years later, with my nephew's diagnosis, all of a sudden we had all of this information, but my brother could not get TAFRA or medical assistance, or the private insurance wouldn't cover the services. So we went the totally opposite direction. What I'm here today to say is it's time for this bill. It's time for private insurance to cover these therapies, and I'm going to ask you to support this bill and the amendment, and please don't make me come back on behalf of my grandchildren in another 18 years. Let's just get it done.
Thank you, Ms. Bender. I certainly hope that will be the case. Okay, thank you, Representative Norton. We have quite a few testifiers on this, and we do have a second bill today, so we're going to need to get through this all and by about 3 o'clock. So we're going to ask people to kind of, I certainly want to give both sides time here. So we have
Madam
next
Chair?
on the list.
Should I remove myself from the table and allow both people to come up at a time?
Representative Norton, I think that would be a good idea. So if we can get the next 2 up there so we can make our transitions pretty quick. Randall Bachman and Sherry Radu, I think, if I'm not mispronouncing that. And if you could come to the table, please. And the next 2 up will be Tracy Reed and Melissa Haley. And just so you can be ready to go. And as you listen to other folks testify, I would just ask people to please listen. And if you certainly, I want to give you the opportunity to testify, but we do have a lot of people, so I would just ask you to try not to repeat what's been said and try to give us sort of concisely your unique point of view, which I know every one of you has. So, Randall Bachman?
Thank you, Representative Liebling, and appreciate the opportunity. My name is Randall Bachman. I work for Access Healthcare in St. Paul, but I'm also the volunteer chairperson of the Autism Recovery Foundation, and I also am the public policy chair for the Autism Treatment Association of Minnesota. My key point, I'll make it brief, is that recovery is possible. Some exciting new information has come out, and I want a quote about that. There's a study that was done by Dr. Deborah Fine, and just recently published. And I want to read a quote from an editorial that was written by Dr. Sally Ozanoff, editor of the Journal of Child Psychology and Psychiatry. Recovery won't be possible for everyone. No, recovery is not the only outcome we're fighting for, but it's high time as a scientific field we talk seriously about this as a possibility. Hope can be a powerful tool. By demonstrating that there is solid science behind hope, we can add fuel to the urgency with a very early diagnosis and intensive treatment of ASD. So my key point is that we have examples of recovery. We have other examples of significant progress. and I think we're on the right track as a society. I also want to make a point that while I believe there's a key role for private insurance, I think it's the entire societal responsibility as well. So I don't want to see medical assistance diminished or any of the other programs. We need all of that working together. Still, private insurance has a role, and it's my belief that if the plans were required to provide coverage, then the burden would be equally shared. Yesterday, you learned from Dr. Wasmer that the average member per month cost by adding autism benefit was 31 cents. Considering the long-term benefit of effective treatment, isn't this modest investment worth it? Thank you.
Okay, thank you very much. And members, you have Mr. Bachman's testimony in writing as well. Thank you very much.
Thank you.
Ms. Radu, if I'm pronouncing it right.
You are.
Please
Thank you.
say your name for the tape. Go ahead.
My name is Sherry Radu. I have something to pass out. It's the general exclusion page for my Blue Cross Blue Shield health insurance contract. I'm a mom of 3 kids. I had 3 kids in 15 months. Yes, I had twins. My oldest son is 6. He is diagnosed with PDD-NOS. My twins, both are also diagnosed. One has severe autism, and one is also diagnosed with PDD-NOS. My husband is self-insured, so we have Blue Cross Blue Shield of Minnesota private policy. We were told when we applied for it there would be a 1-year exclusionary period, and it would cover therapy thereafter. In fact, when I got my policy, I went right to the general exclusions page, and there it is, number 20. Services related to IBIT for the treatment of ASD, including but not limited to intensive early intervention behavioral therapy, intensive behavioral intervention, and LOVIS therapy. Specifically calls out LOVIS therapy, which was unfortunate because that's who we chose as our provider. But LOVIS therapy is just another term for ABA. My beef is that we pay $650 a month for our family policy, and it doesn't cover a treatment that is prescribed by my doctor. If my kid had cancer, this would not be an issue. And we have gone through the process, and we now have TEFRA. I tell you what, it took 4+ months to get through all the paperwork. I had to have all 3 of my kids declared legally disabled. It's unfair, and it's not right, and it's time for a change. So that's all I have to say.
Thank you very much. Next, we have Tracy Reed and Melissa Haley. If you could please come to the table. And then next on deck is Tony Farah. And then we've got Lynn Nelson. So, okay. Please introduce yourself and go ahead.
Madam Chairperson, thank you. My name is Tracy Reed. I own a small business. My mother owns a small business. My father owns a small business. My grandfather was a TV repairman and owned his small business. My grandmother ran a seamstress business out of her living room. Small business runs in my blood, and so does autism. My son, Max, was diagnosed developmentally delayed at age 1. At age 1, his grandmother and I sat in a meeting with the school district. His grandma is here today because she's a very involved person in our family. And I learned that my son's intelligence was in the 1st percentile, and that means that 99% of other children his age would test more intelligent than my son. I did every therapy that I could, speech, occupational, physical therapy, and they didn't bring us improvement. At age 3, my son hurt me in a way that I should have gone to the emergency room, but I was afraid that they would tell me that I couldn't take care of him or that they would make a child protection report. I am a family law attorney, and that would have publicly humiliated me and could have damaged my business. It was only then that I got behavioral therapy. My son was 3 then. He's 7 now. 3 years ago, I started a small business, and when we finally could afford private insurance, we got Blue Cross Blue Shield. And Blue Cross Blue Shield determined that my son's behavioral therapy was medically necessary. And my business, I'm a partner in my business, and we were all very glad to buy the one therapy, the one insurance that would afford my son's behavioral therapy. In mid-November, Blue Cross Blue Shield sent me a letter that said that they would no longer cover that behavioral therapy, which they determined is medically necessary for my son. Everyone in my family, everyone in my business will tell you that we all run because of behavioral therapy. My son now at age 7 has an IQ of 92. That means he has normal intelligence. My son goes to a private school that I got to choose. It's not a special needs school. It's a normal school. He's in class 100% of the day. My son speaks 2 languages. He reads 2 languages. My son downhill skis. He plays the piano. He reads music. He does log rolling in addition to swimming. My son is an absolutely amazing boy, and I can tell you 100% that it is because of behavioral therapy. I am the same type A+ parent today that I was the day he was born. And it wasn't me that made him able to do all those things. It's behavioral therapy. And it's behavioral therapy that Blue Cross Blue Shield knows is necessary for my son. Yet in November, they sent me a letter that said that they won't cover it anymore. And I just want to highlight to the committee that I could not be here and I could not run my business. I couldn't be who I am without behavioral therapy. It is good for the state. It is good for the families. It is good for business. It is good for everyone to cover behavioral therapy. My son is now receiving only consultative services. From October to December, the total cost was only $300 total that was billed to my insurance. That's what I'm asking for, and Blue Cross Blue Shield says no. Without a law, they will not be required to provide that small amount of consult that I need to keep my team running. And so I just ask that you vote yes on this bill. Thank you.
Thank you very much. Next, please introduce yourself for the tape. Thank you.
Excuse me. My name is Melissa Haley. I have something I'd like to get passed out here real quick.
Okay, well, the page will come get that.
I'm going to try and be even briefer than the rest because people have already made a lot of the points I want to make, starting with Representative Norton describing the experience of families being denied health insurance and having to go to TEFRA. What I'm sending around is a copy of the language from our insurance policy, which is Health Partners, where they denied my son ABA coverage. My son does have an autism diagnosis. He actually is one of the few that also we know exactly the cause of his autism. He has a genetic disorder called Smith-Magenis syndrome, which is a chromosomal abnormality. He's missing a tiny little piece of chromosome 17, which causes myriad health problems for him. He's in 3 hospital systems. We have lots of physical conditions that are handled very well by the health company. But the most difficult piece to manage and the piece that I want the help with is the mental health issues. He needs ABA therapy. Health Partners routinely denies it. Unless you pass this bill, they will continue to deny it. Ross Green says the kids do well if they can. You need to give them the tools. And to make sure these kids with autism get the treatments that are medically necessary and effective, we're asking you to pass that bill today. All I'm asking for, in the words of Lucy from the Peanuts gang, is my fair share. If my kid had juvenile diabetes, we'd be paying for insulin because I pay premiums. He has autism, and I want them to pay for the treatments that he needs. Thank you.
Thank you. Tony Farah, and then we'll have Lynn Nelson, and then Kate Johansson, and Mike Hickey after that.
Good afternoon, and thank you for the opportunity. My name is Tony Farah, and I'm a parent of a 7-year-old on the autism spectrum. After he was diagnosed at age 3, he regressed 100% to become nonverbal. I'm happy to say today that he's up to 7 words as of last December. ABA is effective, it takes time, and a lot of patience. I'm here today to urge you to pass this bill because we're paying for insurance that does work. Thank you for your time.
Thank you. Lynn Nelson and Kate Johansson and Mike Hickey, and then Idil Abdul. Welcome to the committee.
Thank you. Madam Chair and members of the committee, my name is Lynn Nelson, and I represent Blue Cross Blue Shield of Minnesota. Today, I am here on behalf of the Minnesota Council of Health Plans and Minnesota's 7 nonprofit health plans. I want to state at the outset that all Minnesota health plans cover autism in the commercial market. However, they do not cover or may not cover every single treatment. So just at the outset, every plan covers some form of autism treatment, but maybe not every possible one. House File 181 would require coverage for very intensive forms of behavior therapy, including applied behavioral analysis, ABA, or EIBI. However, ABA and EIBI are terms used to describe a variety of teaching strategies and behavior management. Treatment should not be based on a single method of intensive treatment as stated in the bill. Instead, what should be developed is a customized, individualized treatment plan designed to meet the individual needs of the child. When prescribed by a healthcare professional, the programs covered by health plans include various forms of therapy, including speech, physical, occupational, and medications based on the needs of the child. This bill also creates a new definition of medical necessity that is specific to autism. This is unnecessary and potentially harmful. Medical necessity is already defined in State Statute 62Q.53. That statute is written to allow healthcare providers in the same or similar general specialty as typically manages the condition, procedure, or treatment at issue to determine medical necessity parameters. This allows for objective review of the treatment parameters by qualified professionals without a vested interest in the proposed treatment modality. Coverage for treatments for ASD should be subject to the same rigorous standards. To allow for therapeutic flexibility suited to each child's severity of symptoms and environment. The cost associated with intensive behavioral intervention is incredibly high. In 2011, the Minnesota Comprehensive Health Association, Minnesota's high-risk pool, spent over $4 million on 70 patients at one facility that provides ABA. This is an incredible amount of money to spend on a treatment that has not been scientifically proven to be more effective than other treatments that are covered by the health plans, as I indicated before. This additional expense will fall on individuals and small business owners at a time when healthcare premiums are rising due to the changes in the market rules both inside and outside the exchange. This bill does exempt the state from the mandate for both the state employee health group and public programs. However, the state would still be responsible for some cost. Under the Affordable Care Act, the proposed rules for the essential health benefits, the state is permitted to mandate state-required benefits that are above the essential health benefits set. But the state must make payments to defray the cost of these additional benefits for all qualified health plans. In our interpretation, this is not limited to only those who obtain a federal premium or cost-sharing subsidy. It is for all QHPs, even outside the exchange. The default benchmark plan for Minnesota is Health Partners Small Group Plan, was identified in the proposed EHP rule as including habilitative benefits. If the state mandates coverage of a specific intensive treatments for ASD, it will be responsible for defraying those costs of the mandate for purchaser of QHPs. In closing, health plans have a fiduciary responsibility to their purchasers, employers, and individuals who pay premiums for health care coverage and to enrollees who provide the services. This bill, as drafted, restricts the health plan's ability to fill that responsibility. We will continue to work with Representative Norton, and we have, I don't know where she went, and we have in the past, and when she's introduced this before, to work on the bill language, and I thank you for this opportunity to testify.
Okay, thank you, Ms. Nelson. Kate Johansson. Then we've got Mike Hickey, then we've got Idle Abdul, then we've got Tricia Stark.
Thank you,
Welcome
Madam
to the
Chair
committee.
and members. My name is Kate Johansson. I represent the Minnesota Chamber of Commerce and its 2,400 employers, 80% of which are small businesses that generally purchase insurance for health care through the fully insured market. The Minnesota Chamber appreciates the opportunity to testify on House File 181, but we do unfortunately have to oppose the bill. Many of our concerns have already been summarized by Ms. Nelson, so I won't waste the committee's time by reiterating them, but I will just say that we do think that there is customized treatment available through the commercial market that will help patients and providers offer the care that is necessary for folks that will help them. Second, there is an issue, I think, around creating a new definition of medical necessity that could potentially balkanize and create confusion amongst our current statutes, and that might not be helpful. Third, I would say that we are concerned that the statute does not apply to state employees. If this is something that the state wants to pay for, or state wants businesses to pay for, it's appropriate to apply that mandate throughout rather than, again, asking small businesses and individuals only to pay expenses. But that fourth point, expense, is the one that I really do want to focus on because it is the most important aspect of adding a new mandated benefit. And that's what this is. This bill does create a new mandated benefit. It makes health insurance more expensive for small businesses and individuals. And with that in mind, Minnesota already has one of the highest numbers of any states with mandated benefits. Our small businesses are already paying for more of these mandated benefits than small businesses in other states. This one is, as Ms. Nelson mentioned, particularly expensive with a cost of $4 million for just 70 patients. And that is unfortunately very poorly timed because there is tremendous uncertainty in the healthcare world right now and a lot of factors that will contribute to premium increases for small business. There's a 3% MCHA assessment coming in 2014. There's a 2% premium tax at the federal level that we can do nothing about here. And pending the outcome of the state's exchange legislation, there may be additional premium taxes that are passed through directly to fully insured consumers. We're also concerned about looking generally, when we look at new mandates, at the cost effectiveness of a mandate before imposing it. This is particularly important, again, because, as Ms. Nelson mentioned, as the state faces the establishment process of an essential health benefit set, the state will have to incur any expense beyond what is covered by the EHB. This mandate would not be included in that. So with those comments, I would conclude my testimony, and thank you again for the opportunity to speak with you.
Thank you, Ms. Johansson. We had a question from Representative Mack. Was that for Ms. Johansson?
Yes, I will.
Okay. Ms. Johansson, if you can come back. I don't know where she went. Oh, there she is. I'm sorry. There she is.
Hello, Madam Chair.
Yeah, please.
Thank you, Madam Chair. Just
Representative
a
Mack.
brief question. We had some testimony yesterday from a gentleman who works on this issue nationally and can kind of do a state-by-state comparison. And he talked about, on average, I think the number he put out, and Representative Norton could probably maybe speak to this later, but that premiums went up about 31 cents per member per month. Do you guys either know of that same data or have other data that refutes that? Some information just to get an idea of what this means for average premiums on a monthly basis would be helpful. Just wondering if you have any information on that.
Madam Chair, Representative Mack.
Johansson.
I do not have that information immediately on hand. Certainly I could get it for you. The information that I do have is that Minnesota currently has 64 mandated benefits, and I can provide information as well on how those have inflated premium costs in our state vis-a-vis other states. And I'll look specifically at this mandate as well.
Representative Mack? Okay, thank you. Okay, Mike Hickey, and then Idle Abdul and Tricia Stark after that. Welcome to the committee.
Well, thanks, Madam Chair, and congratulations on your new chairmanship. Mike Hickey with the National Federation of Independent Business. We're the major small business group in the state and also the largest employer group with 13,000 members and a significant member base in every district. And as I've said many times before on discussions about mandated benefits, we're clearly the most affected group of these. Our members cannot afford to self-insure. They're in this, and when they do the thing they want to do, that is help their employees and provide a good benefit for them, they are stuck in the state-regulated market. And we certainly understand what a compelling and dire problem this is, but once again, our solution is just missing so much of the mark. It is only hitting the state-regulated market, which I believe is down to 25% now. So this is not going to touch 75%, minus the public programs. We're just talking about privately insured. It's not going to touch 75% of the employees in the state. And, we can, pretend we're really accomplishing something, but we're not when it's that lopsided. And with all the mandates, it's been that way, and it's been that way for a long time. Another issue that's come to the fore, or it's been around for a long time, but it's gotten so much worse with, I don't want to get too far off the topic, but the assessment on small employers now, especially with the proposed and ongoing ones with the ACA, is really dramatic. Small business is going to be paying between 12.71% and 13.11% of premium starting in about a year. And the large self-insured companies won't be affected by this, pay 2.86. Now, it's a little off topic to this, but it just shows you the total inequity we have here with about 68 mandates placed on the small employer market, which is shrinking, and then 12.7 to 13.1% in assessments and taxes. and virtually none of it's touching the self-insured. And so that is our biggest concern. We certainly realize how dire the problem is and how the families struggle with this, but you're not reaching many people. And did anybody ask any of the witnesses today how they're insured? Some of them may have been with self-funded plans, and they're here because they care about the issue, but they may see no benefit out of it if something was passed. Back in 2009, we spent a lot of time on this issue, 2009 and 2010, and we got a little curious about, we thought this is maybe the most expensive mandate we've ever seen for those who would be affected. I realize you have to have an autistic child on your plan to really see the full brunt of the increase, but Blue Cross gave us some stats. $30,000 was their average cost. $100,000, the cost could run up to $100,000 a year when they had something very similar to this bill, which I believe they've discontinued now, but they definitely had it back in 2009. It was a very good yardstick. We compared it to maternity costs with one of the major providers in the Twin Cities area, and their median cost ranged from $10,400 to $16,000 versus the $30,000 average cost Blue Cross had. So we may have stumbled into the most expensive mandate we've ever seen, although I realize it's not going to affect a lot of people, and you'd have to have an autistic child on your plan. But when you consider all that in totality and how few people are going to benefit, and the hypocrisy of the state to exclude these mandates from their benefit plan. And if you go ahead with this, I urge you to include the state, so the state at least incurs these mandates as we go. But when you roll that all together, we just cannot afford the burden of something this expensive. And I would urge you not to do it, despite how compelling the problem is, because we're not solving much of the problem. So I appreciate the time.
Thank you, Mr. Hickey. Idle Abdul? I don't think Ms. Abdul is here. Tricia Stark? Oh, I'm sorry, and there was a question from Representative Grunhagen.
I'll wait till after testimony. I just want to get on the list.
I would appreciate that,
Yep.
Representative Grunhagen. And we're close to the end of the testifiers here, and
Yep.
then we'll have a few minutes. Right, welcome to the committee.
Thank you. Good afternoon. I'm Dr. Tricia Stark. I'm a licensed psychologist and chair of the Legislative Committee for the Minnesota Psychological Association. Thanks for the opportunity to speak to this bill. Providing screening, early assessment, and intervention is crucial in the lives of individuals and families struggling with autism spectrum disorders. Coverage for early intervention services will assist families in better meeting the needs of their children. But applied behavioral analysis can be a powerful tool for individuals with autism spectrum disorders, but it is one of several treatments. And as you heard yesterday, treatment must meet individual needs. In terms of this bill, the Minnesota Psychological Association is generally in support, but would ask you to consider some things that may affect how it's administered. The first issue has been identified already, and that's medical necessity. The change is pretty significant. We'd also ask you to consider a more generic term that reflects the broad scope of therapies that are required. And calling out particular therapies, I worry that it will privilege certain ones, and then others that are really important will not get met. I'd also encourage you to consider clarifying the utilization review process that's contained in the bill. It's a little fuzzy, but it says that the payer would have to do whatever is in a treatment plan. That's a lot of power to give to a provider. I mean, certainly we work from treatment plans, but I've never been able to do everything in my treatment plan. And with that, I'm going to turn to my colleague.
All right, thank you. Welcome to the committee.
Yes, I'm Dr. Penny Giesbrecht, and I'm on the list, so I'm not budging. I'm here today. I actually am a member of MPA as well, and I'm a clinical psychologist in private practice, and I teach at Bethel. I supervise interns, some of them who are in autism programs. But I'm also a parent. I have a child who will be 35 years old. I still call him a child because he's profoundly autistic. And I just want to urge you, I'm thankful that legislation is here that insurance would pay a fair proportion of services for autism. But I too am concerned about ABA and LOVAS being called out. Discrete trial behavioral therapies are helpful to some kids, but it really is only one therapy. And in the past, as a clinician, I've had families who have believed they've been told by some of the agencies in town that ABA would cure their kids. And they aren't cured. Some of them get better. Developmentally, kids with autism do improve. In fact, they continue to improve throughout the lifespan. But I haven't seen a cure in any of the families that I've worked with. I don't only work with autistic families, however, but I see them improving. I see them having good lives. And my concern as a parent of a son that we call Punky Boy at 35 is that we are very, very careful to use our dollars wisely. These families that are here and the mothers and dads that are here, this is a long haul. We're not done with it, in a few years. And I've had now 33 years of being promised a cure from a variety of treatments, and I tried many of them. And it never happens that there's a cure. But we need to take care of these people. They're wonderful human beings. Our Punky Boy is a blessing to his community. But we need to be responsible in how we do the language of this bill. If we say to a mental health provider, you can prescribe what's needed, and then insurance has to pay everything, it just invites, even if there aren't any people like that in town now, believe me, there will be. When waivered services was that federal mandate came about, all of a sudden we had agencies all over town charging a much higher fee per hour and then paying kids, college kids, $8, $9, $10 an hour. And a lot of the same thing is happening with ABA, because I've had some of those people be my patients where some of the behavioral analysts have several hours of training, but it's billed at a much higher amount. And then administrators and others get that money. And we just can't afford that. And I say that as a parent, even more than a mental health provider. But I've had a couple of families who I will say have never fully recovered from being promised that their kid would be cured if they just did the right thing, enough hours, and they put all their energy, all their money, all their time to that. Their kids weren't cured. And one mom was suicidal for years because of the blame she felt and the shame she felt. So thank you for doing your part for autism, but really be careful of the language, I think, and include all the treatment modalities, because right now that's all we got.
All right, thank you very much. Is there anyone else in the audience that really wants to testify for or against this bill? Is there somebody over here, please? But I'm going to ask you to be very brief, though, because we are quite low on time here. Please, welcome to the committee. Please state your name.
Hi, my name is Tisha Meddy, and I'm a parent. My son Aiden will be 8 in April. He was diagnosed with autism around 15, 16 months of age. It was when he regressed, he was diagnosed at 2 years. At that time, we knew about ABA. We lived in South Dakota. We had one provider in the state. We knew how expensive it was. We tried speech, OT, PT, like the doctors recommended. Didn't do much. We had the Birth to 3, the school district in. Again, didn't do a lot. So we found a provider, begged, borrowed, and everything we could from family members to help us out. We got an ABA program started. He definitely started to do better. We did some biomedical things as well. And he progressed. But it was so expensive that my husband's insurance at the time didn't pay for it. My husband changed his job 4 times. He was in upper management and took whatever job he could find, thinking we had the right insurance finally. And no luck. And my son made such great progress that we knew we had to continue on. And so my husband went from being an upper management to a delivery man that was out of Minnesota. We had Blue Cross Blue Shield in Minnesota. They paid for all of his therapy when we were in South Dakota. July of 2011, we moved to Minnesota because he was making progress, but we knew about the LOVAS Institute. And caveat, our plans from previous plans also spelled out no LOVAS, no ABA, no TEACH. We moved to Minnesota. We got started with LOVAS. We've been here since July of 2011. My son was here yesterday. I don't know if anyone noticed. He was the only child here sitting over there with me on the iPad. He's not recovered, but 6 months ago, had I brought him in here, he would have either screamed nonstop, beat me to a pulp or, had a major meltdown, he couldn't sit here for 5 minutes. He sat through that entire thing yesterday. Yes, he was on his iPad, but my son couldn't have done that, a few months ago. So early intervention does work. Very briefly, Blue Cross Blue Shield, now that we've moved to Minnesota, had some policy changes. They're cutting back and cutting back and cutting back our hours. We are a self-funded plan. It's an ERISA plan. But they are cutting back hours as we move along, and it's been a battle. I have fought them for 2 years now. As he's getting better and we're nearing the end of the ball game, the ninth inning, so to speak, they want to cut his hours. And we've made the decision to find the money to get it paid, to give him the full program so he will recover. If we didn't do that and we cut the hours, I believe he would regress because we've seen that when we take long breaks. So anyways, Blue Cross, other insurance, private insurance, I would like to see self-funded, federally, follow along. It's absolutely necessary. And it must happen. And as a parent and a legislator, please think about that. Think about how these kids can be successful. They can come to a meeting and sit and be respectful and not be able to function. So thank you very much.
Thank you for your testimony. I think we had a couple of questions, and Representative Norton, I want to give you some closing comments, but I wanted to give members an opportunity because I think there were some questions here. Was Representative Gruenhagen? And then Representative Albright.
Oh, thank you, Madam Chair. I was just wondering if Lynn Nelson would also come up to the testifier. Oh, she's on her way. Okay. I just want to say right from the outset, I have a nephew who's been diagnosed with autism, and it's my sister-in-law. Her husband passed away, so she's a widow. I understand the hardship of it and the need for early intervention. I do believe in early intervention. I think it has the potential to cut costs in the future. I do disagree with the bill, though, on several points. One is I have a problem with the ACA not covering it if you're in the ACA and the private market having to cover it. Also, the fact that I understand the governor's the governor's budget has $12 million to go into the ACA to cover for treatment for autism. Is that correct?
There will be $12 million,
Representative
Madam
Norton.
Chair. There is $12 million in the budget, and they're talking about targeting it for early intervention, but they haven't really rolled out all the details yet, so I don't know exactly where it will be spent, so we'll have to wait.
Representative Gruenhagen, and please, if you have a question.
Yep, I'm getting to that. Okay. I'm trying, but I want to set the table first. The other thing is, I believe this can be addressed with MCHA and spreading the MCHA tax, not just on 25% of the healthcare industry, but on 100% of it, self-insured, state employee, and all plans in general. And the MCHA has worked very well in this state to cover uninsured people that cannot get normal insurance. And with the Healthy Minnesota Contribution Plan, if we expanded that to include children, people with difficulty covering the premium could get help. Now, the other thing is that in the private market place, 70% of cost for health care premiums or for the medical costs are due to administrative costs. And we had testimony about administrative costs and even in relationship to autism. So I think that we need to attack the administrative cost and lower that and look to MCHA to solve the problem rather than going to the ACA where we're going to jump our administrative cost to about 85 cents on the dollar, leaving about 15 cents left to actually help the child. The other thing, with a 7-member unelected board, they can decide what to cover and what not if costs start spiraling out of control. So with that, don't you think that would be a better solution? And I guess I'd like to hear from both of you to go towards a direction where we in Minnesota can solve the problem rather than this blanket mandate for 25% of the market. I hope you follow me on that.
Okay, and before you respond, I just want to say, members, we're running much later on this bill than we should be, and or than we'd planned, I should say, and glad to hear the testimony. It's a very important bill. I don't want to cut anyone off. So, we may have to, I'm just letting everyone know that we may come back this evening to hear the second bill that's on our agenda if we need the time for this one. So Members, if you have a question and you really want it answered, please, I don't want to cut anyone off, but just know that if we can't get to the second bill, that we will come back this evening.
Thank you, Madam Chair.
Go ahead, Representative Norton.
I'm Representative Grunick, and I'm not a MCHA specialist, but I have been following some of the changes that are occurring, and it is everyone's expectation, I believe, that MCHA is going to disappear. So I don't know if you saw the handout that came out about utilization, and not to pick on Blue Cross Blue Shield, because I'm actually quite sympathetic to what they went through. Had we passed this bill 3 years ago, all the plans would have been providing this service. They were the only ones, and so everyone was jumping onto Blue Cross Blue Shield. It was terribly unfair to them. And so they changed their policies to match the rest of the state, unfortunately. I had hoped that they could hang in there, but it was tough for them. And so the increase that you see in MCHA from this last year on the form that I had in your packets, I hope, is because the Blue Cross Blue Shield folks are now either going on MCHA or TEFRA. So both TEFRA and MCHA see increases when we do this. TEFRA is state-paid. MCHA, yes, premiums pay, but that also means co-pays for families who may well not be able to afford it. So the state still, or families are still being hurt by this option, which I think is going to disappear in a few years anyway.
Lynn Nelson from Blue Cross, and I just appreciate Representative Norton's comments about the decisions we made. I'm not sure about how to answer your question, but I agree that MCHA is scheduled to slowly go away, if not at 1/1/14, when the exchange goes into effect, and the ACA with the policy
Madam
that will go into
Chair,
effect.
just a point of clarification.
Representative Gruenhagen.
Thank you. What I mean is expanding the MCCHA tax to all plans, self-insured, right across the board. Wouldn't that provide a bigger base of funding to that plan?
Madam Chair, Representative Gruenhagen.
Nelson.
A broader base tax, but I'm not sure what exactly you're asking to fund. If you're asking to fund the exchange.
The MCHA.
For MCHA, a broad-based funding source, a broader base would be more beneficial than just on this fully insured market.
One follow-up question.
Representative Gruenhagen.
There's a host of problems with the ACA. We don't have to do it, in my opinion, but that's for another day. The point is, you're just going to add to the bureaucracy in the ACA, and parents, you're going to have to jump in and out of the ACA for coverage and to maintain your credit in the ACA. It's a discombobulated approach. I've got specifics on it. And the other thing, there is a Dr. Disher that has done tremendous research, some people disagree with it, that shows that the spike in autism in our society is due to including fetal tissue in many of the vaccines. We had her testify last year, I believe, in this committee. I did bring her handout, and for those parents who have that, would find that interesting, I'll ask the page to make it available in the back. Thank you.
We have a list, members. We've got Representative, just so you know, Representative Albright, Lomer, Schumacher, Huntley, and Franson. So, Representative Albright.
Thank you, Madam Chair. Representative Norton, in the beginning of your presentation, you made reference to whether or not the essential health benefit included ABA treatment. Is that, in fact, going to be included under the essential benefit in the ACA?
Thank you, Madam Chair. Representative, it is not going to be part of the essential benefit set because we did not choose the essential benefit set last session. And so federal law required or had a methodology for figuring out what plan that would be, and they took one, and it does not have ABA in it. So this would be in addition to, it would be an additional state mandate.
Representative Albright.
Thank you, Madam Chair. Representative Norton, if that's the case, then are we contradicting inside of our own state insurance exchange that which is mandated by ACA? You see where are we in conflict?
No, thank you, Madam Chair.
Representative Norton.
I'll slow down a little. Hurry. The feds have opened the door for that, and they made an exemption. They made a ruling, really, that we had up until last year to add any mandates we wanted to get to pick an essential benefit set. We didn't do that, but they also said, but if you want to add them after that deadline, you're welcome to, but you will have to help pay for those. So they did put that escape hatch, if you will, in there for states.
Representative Albright?
So if that's the case, do we have a number in terms of what that costing would be?
Representative Norton.
Thank you, Madam Chair. Yesterday, I just gave my handout away to someone else. You have it in your packet from yesterday. They do have the averages of the 33 states that have already passed this mandate. We are way behind the times on this, and Minnesota usually is a leader, particularly in healthcare, of the costs in those other states. And I thought the second page of that handout was really telling, because what has happened is that states get fiscal notes, and the fiscal notes have been huge in all the states that this bill has moved forward on. The fears, this is going to be terrible and expensive. And in fact, what they found is they were a fraction. Look at the numbers on that second page of the handout. I know you guys all have it. If you saved it, and if not, I will get it to you afterwards. It is a fraction of the actual cost for the states that are doing it. And so, again, the average is 31 cents. Some states, even after 2 years, it's 10 cents per member per month. It's very, very low. And as far as our state, there will be some cost savings to the state because we will be able to get folks off TEFRA and into the regular market where they belong. But there will also be a cost to the state, and we can't get those numbers until we get to go to Commerce, which is our next committee, when we'll deal with the finances. And then we'll also come back to Health and Human Service Finance one other time so those finances can be reviewed yet again. So I will have those numbers. I do not have them yet.
Yeah, Representative Albright, I was going to jump in and say that as well, that this is not the last stop for this bill, and it will have a fiscal note eventually, and that issue will be discussed along with all the other fiscal notes in Representative Huntley's committee ultimately before it ever goes to the floor.
Okay. I just have two more questions.
Representative Albright.
And these are more to the point of definitions, just because of the what is meant by medically necessary care?
Representative Norton.
And feel free to invite back one of the testifiers if that's more appropriate.
I'm sorry, I gave away my copies of things and I don't have it with me. Oh, that's the wrong one. What we were trying to do with medically necessary care is make certain that we did not have too broad of a definition, so that there is definition in current law as well for medically necessary care, but we were trying to make certain that the therapies that we are going to require now of insurance plans were reined in enough that it didn't open the door for everything everybody thought of. There are many, many experimental and unproven treatments out there, which is why we used an evidence-based. We try using medically necessary and evidence-based as prescribed by a physician or a psychologist, the person that does the diagnosis. Just as you go in for cancer and someone gives you a diagnosis and prescribes a treatment, it's that professional that will make those decisions about what is best for that child. Not a provider that may say, as was mentioned earlier, and that was one of the points I wanted to touch on, it's not about providers saying what you need, it's about the diagnosis and the team that makes those decisions about what's best for you. So we're trying to put some controls on it.
Representative Albright.
Final question, then. Thank you, Madam Chair. To follow on to that, then, and just help me understand, there are acronyms floating around, the IEIBTS, the IBI, and then LOVAS therapy.
Yep.
Are they,
Sorry, Matt.
because we're dealing with definitions, and because of the autism, and I understand from the testimony yesterday that we're dealing with 5 different partitions of the spectrum. Are any of these, they are separate and distinct, am I correct, in the therapy?
Madam Chair?
Representative Norton.
I don't know about 5, so I'm not going to speak to that. But the spectrum is for autism is about the child and the child's need. Services, as was mentioned by the psychologist, should be individualized to the needs of every child as determined by an appropriate physician or psychologist.
Okay. And so Madam Chair?
Representative Albright.
Thank you. And so the professional is going to diagnose the behavioral therapy necessary
They will recommend
for
one,
each,
Madam Chair.
for each patient under that guideline.
Representative Norton.
Madam Chair, the line that you're speaking of is not a guideline. It is one of many therapies, and you will see there's 1, 2, 3, 4. Those are all potential therapies based on the diagnosis and where a child is on the spectrum. A child may only be diagnosed if they're mildly diagnosed with a mild level or Asperger's. They may need speech therapy. They may not. They may need occupational therapy. They may need nothing. If you're on the very severe end of the spectrum, most often that's where you will see these terminologies that you use. And I will say, intensive early intervention behavior therapies. There's IEI. They're all just acronyms that are ways to say a method of applied behavior analysis, which is a broader term. An intensive early is focused at the very young children as quickly after diagnosis as possible. LOVAS is another type, and I appreciate you bringing that up. It is a particular methodology. It actually is what ABA sprung from, was a type of treatment. It was when it was first developed, I actually went to hear Dr. Lovas, or I don't know if it was a doctor, Mr. Lovas, when he was in town. It was more punitive in its early years. It was very one-on-one, very intensive, and it was a little, there were rewards, and it was a little, look at me. It made people a little nervous at the time, but it has changed significantly from them, and other forms, other ABA therapies have sprung off. So one type is not going to be right for every child, and whomever made the comment that someone is promising cures, I've never heard of that. I absolutely would never, ever promise a cure, and I can't believe anyone with any, that I could have any respect for would promise a cure to a parent. Promising best outcomes, promising improvements. We put in the bill an evaluation can be asked for every 6 months to make certain that the child is improving, and we're not paying for something that isn't working. So it's not cut and dried. It's not easy to explain because it's a spectrum of treatments, therapies. Most often, parents will be given 15 to 20 hours a week. On a rare occasion, you'll see children being given a full spectrum of 40 hours a week. And frankly, parents are expected to carry this into the home as well, and if we're lucky, in school.
Thank you, Madam Chair.
Representative Lohmer.
Thank you, Madam Chair, and Representative Norton, thank you for doing this bill. I really sympathize with these families. I think that Representative Albright maybe already asked my question, but I want to make sure that I do understand, because we're not covering our state employees in this bill, and the reason for that is
They're already covered.
Representative Norton.
Thank you, Madam Chair, for reminding me you're there. I know you're there, honestly.
They are already covered.
And I have the CGIP plan, Madam Chair.
With Blue Cross Blue Shield. Okay.
Here. It is covered in CGIP unless something has changed, and potentially with Blue Cross Blue Shield's changes, everything is starting to have an effect, a trickle-down effect. But both MA and CGIP it's covered in their plans.
All right, thank you.
Representative Schumacher.
Thank you, Madam Chair. Representative Norton, I think it was Mr. Hickey who was giving testimony that said that the bulk cost from the premiums will still be towards the families that utilize these services or something along those lines. Is that just because of the cost after the deductibles meant for the year that they would still incur a bigger portion of the cost than what would be spread out among the plans?
Representative
Madam
Norton.
Chair. I believe what happens in those instances is plans that don't have a child, a small group plan, if a child is not diagnosed with autism and there isn't one in that business, they're generally not affected. If there's a family and they have a child that's diagnosed, what happens often is the previous years, your premiums can go up if it's a high utilizer, and that can be true of cancer or pregnancy or any large user occurrence in a small market can impact all the people in that market. And so the potential certainly is there. And I wanted to mention, I know the Minnesota Chamber spoke and that they have a no mandates position and always have, and any of us that have been around a while know that. My Rochester Area Chamber of Commerce is very supportive of this bill. And we have many small business owners who offer to come up and testify because they know the devastation in their families, and they know that the state's going to pay in the long run, and they just assume provide appropriate service early on and not have the long-term costs. So if you have more questions, I'd be happy to answer.
And members, before we continue, I just want to announce that we are going to reconvene at 4 o'clock. We're going to go on as long as we need to finish this, but if we get, this room is needed at 4 by another committee, so we're going to go down to the basement and continue. We'll discuss this bill as long as we need to, and then we'll go on to our second bill. So feel free to take all the time you need. Representative
Well, thank you,
Schumacher.
Madam Chair. Oh, and I just have one quick follow-up with that. Representative Norton,
Yes.
you obviously have done a lot of research on this, and I appreciate that. The 33 other states that have already passed legislation on this, how close does the language in this bill track with what those other states have done? And that's all, Madam Chair.
Thank you.
Representative Norton.
Madam Chair, our bill is probably less complicated than some, and I will tell you, they all basically do the same thing. Some of the states have caps, age caps, price caps, various other restraints, if you will. Not all states. Some are opened wide. And I was really interested in seeing the difference in the states and the amount of service being used, because it's not significantly different, despite the variation in all the different states. We can and could make it more restrictive. I think the parents and the providers would prefer to be able to access what's best for their child and not be restrained. Certainly, as we get toward the Finance Committee and we get a fiscal note, we'll talk more about constraints that may or may not have to be placed on the bill at that time.
Representative Huntley.
Well, Madam Chair, just a comment on some statements that were made by some of the members of this committee. There is no journal article in a peer-reviewed journal that says we have 70% administrative costs in health care. That is completely wrong. Our health insurance companies run in Minnesota at about 8% administrative costs. And yes, the doctors and clinics have some administrative costs, but no way does it ever get close to 70%. Secondly, we cannot shift the cost of MSHA to self-insured companies. The member that suggested that, and will also suggest it tomorrow on my committee, ought to read the federal law on ERISA that regulates self-insured companies. And when we got our, we can put a tax on self-insured payments of provider, okay, up to about 2.5% to 3%, and then the federal government says no more. You can't tax self-insured companies any more than that. And when we were at 2.5% with Minnesota Care, we were real close to violating the Fed. So you can't shift any big amount of costs to self-insured companies. It violates federal law. And I will say, well, I'll leave it at that.
Madam Chair. We have other members on the list, so Representative Franson is next.
Thank you, Madam Chair. Representative Norton, thank you for bringing this bill forward. As a mother of 3 children, I am very thankful that none of my children have had to experience autism, or my family hasn't had to go through that experience. But also, I'm one of those parents that no longer vaccinates either, because of the fear that I have had talking to other parents that have experienced their child becoming, experiencing autism after what they believe correlated with the vaccinations. But I'm just curious, we can talk about insuring, and that's great, and that's, hope for the families that are experiencing autism now. But what I'm really interested in is ending autism, and so that autism is a thing of the past. And just with my own research online, and mercury is one of those things it's a poison. It's a neurological poison here that affects developing babies in the womb. It affects small children. And California, Oregon, and Minnesota are the 3 states that have the highest incidences of autism. Could you, or do you know of any information that you may be able to share with us on what your beliefs are or theories are from the task force on what causes autism and what is being done to hopefully end this?
Representative Franson, this is really off topic. The bill is not about the origins of autism. And so I think I'm just going to go on to the next person. I think there'll be other opportunities to have this kind of discussion, but today is not the day. And as I said, we're going to reconvene at 4 in the basement. We can talk about the bill for as long as members want, into the night if you like. I will be happy to stay.
We wouldn't.
But, well, if not, then please let's have a discussion that at least is relevant to the bill. And I know the bill has important issues that need to be fleshed out, so let's stick to those issues. Representative Schoen is next.
Madam Chair, thank you. Could somebody from the chamber come back down? Who testified from the chamber? Are they here? So, and then I also, Representative Norton, you, Madam Chair, Representative Norton, you had 33 other states. I just wanted to make sure I had my math right. So we're going to be number 34?
Hawaii's taking the bill up today.
Oh, really?
They might beat us.
Well, let's get to 35. But is the chamber person here?
I think they left.
I
Well,
guess not.
I'll see if Representative Norton can answer this. You talked about the financial implications, and what I wanted to ask the chamber was, do we have any information that any companies in these other states are filing bankruptcy or laying people off because they offered this as part of their insurance?
Representative Norton.
Representative Liegling, Representative Schoen, I know of no horrible impacts in any of the other states as a result of the law. And in fact, I would point to the fact that Minnesota, while it is indeed one of the states with the highest number of mandates in the country, we also have some of the lowest health care costs. And I would say there's a direct correlation to that.
Thank you for that extremely clarifying point.
Thank you, Representative Schoen. I have Representative Grunhagen on the list, but only Representative Grunhagen's is it to the bill?
Yep.
Thank you.
Well,
Representative Grunhagen.
Thank you, Madam Chair. Just 2 quick comments in response to Representative Huntley there. Is that I agree with him on the uninsured. I stand corrected on that. I appreciate that, Representative Huntley. As far as the administrative costs, that came from a private practice doctor less than 2 months ago. I could see if he'd come and testify that if he had to join a large medical center in the metro area, his cost would go from 35% up to 70%. And just one illustration on that, and be my final cost. In Plymouth, there's an MRI Pathways, and you can get an MRI for $109 at MRI Pathways. They don't accept Medicare, they don't accept Medicaid, they don't accept private insurance. They only accept cash. I called them and said, what if I got the same test in a hospital versus just paid cash for it? They said you'd be billed in the metro area between $2,500 and $5,000. So here's an organization that doesn't accept any Medicaid, Medicare, or private insurance, and they can do for $109 what a hospital would have to charge $2,500 to $5,000 for. Something's wrong. Thank you, Madam Chair.
Madam Speaker.
Oh, okay.
Sure.
Representative Huntley, if...
3 questions.
Okay, Representative Huntley.
I have a nephew that had an MRI done in Norway, and it cost him $42.50.
Okay, thank you, Representative Huntley. Representative Norton renews her motion.
What bill are we on, Madam Chair?
On House File. Representative Norton renews her motion that House File 181 as amended be recommended to pass and be referred I'm sorry, I will make the motion for Representative Norton that House File 181 as amended be recommended to pass and be re-referred to the Committee on Commerce and Consumer Protection, Finance, and Policy. All those in favor, please say aye.
Aye.
All opposed, no.
No.
The motion passes. The bill is passed and re-referred.
Thank you very
to the
much,
Commerce Committee. And members, we will stand in recess. We will meet at 4 o'clock in the basement hearing room to take up House File 164.
I got another meeting.